Hi, I'm Dr. Matthew Schulman, and let's talk Mommy Makeovers. The first thing we need to do is really define what a Mommy Makeover is. Basically, it is multiple procedures put together into one operation. So Mommy Makeover is really like a cute term that originated because women would come in and they'd want to have one operation to restore their body back to their pre-pregnancy state. And that's why we use the term Mommy Makeovers. So even though it's a cute term, the truth is it really doesn't mean anything because no two Mommy Makeovers are the same. So if you get a Mommy Makeover, it may involve a tummy tuck, a breast lift, and liposuction. But if somebody else gets a Mommy Makeover, maybe it involves a Brazilian butt lift, breast implants, and a facelift. So, the term is a little bit confusing. And it's very common for people to call at my office and they want to know what the price is for a Mommy Makeover. And we're very upfront about prices, but we actually can't answer that question because your Mommy Makeover is different than anybody else's Mommy Makeover. It's almost like calling up a restaurant and saying, how much is food? What are you talking about? Are you talking about the steak, the chicken, the lobster? So Mommy Makeover is a really popular procedure, but it's kind of confusing. So most commonly, a Mommy Makeover involves something for the stomach. So that's where you might get a tummy tuck, you might get just liposuction, oftentimes something for the breast. Maybe you want your breast bigger with implants. Maybe you need them lifted with a breast lift. Maybe you actually need them smaller with a breast reduction. And sometimes things like Brazilian butt lifts, maybe you have some extra skin on your arms or on your inner thighs. So a lot of those things can be done together in one operation. The reason that Mommy Makeovers have become so popular is because we've gotten a lot better at doing multiple procedures safely. The technologies have gotten better, surgical techniques have gotten better, anesthesia has gotten better. So back 30 years ago, it wasn't really safe to do multiple procedures in one operation. Today, we're able to combine multiple procedures safely. That's assuming that you're having your procedure done by a board-certified plastic surgeon. You're having it done in an accredited operating facility like a office operating room, ambulatory surgery center, or hospital, and that you're being monitored by a board-certified anesthesiologist. As long as those things are met, then you probably can have multiple procedures done together in one operation, and it can be done safely. There's definitely a limit to what you can do together, and that is partly because you need to stay safe. The longer you're in the operating room, the higher your risk gets. So generally when you start adding multiple procedures together and your operating time gets longer, then it gets a little riskier for you. So as a plastic surgeon, there's a certain amount of time where I want to keep your surgery below. Generally, we want your surgeries to be no more than 5 or 6 hours, because the data clearly shows that when surgeries get over 6 hours, the risk for complications increases significantly. The other thing you should keep in mind is that not every procedure does well together. There are certain procedures that work well together and they can be done during the same operation, but there's other procedures that don't do well. For example, if I'm doing a complex breast procedure on you, where I have to do a lift and maybe fix some asymmetries and then put implants in, I wouldn't want to do that at the same time as like a Brazilian butt lift, because the Brazilian butt lift would require that you don't sleep on your butt. But a complex breast procedure would involve that you don't sleep on your stomach. So how are you going to sleep? So as you can see, there's certain procedures that don't really work well together in one operation. So if you're interested in a Mommy Makeover, the first thing you should do is find a board-certified plastic surgeon that's experienced in that procedure. The thing you have to understand is that just because a surgeon is really good at a tummy tuck and they're also really good at breast implants, doesn't mean that they're really good at doing a tummy tuck and a breast implant in the same operation. There is very specific nuances and things that have to be done when you're combining procedures. So just because someone is good at the individual procedures doesn't mean they're good at doing them together. So you want to make sure that your surgeon is experienced at multiple procedures in an operation. The other thing to keep in mind is that even though we use the term mommy makeover, you don't have to be a mommy. You can be, just someone who sees changes in their body from aging, or you could have lost a lot of weight and you have excess skin throughout your body, so you may want skin removed from your stomach and you want to have your breasts lifted. So if you do all these things together, technically it's like a mommy makeover, even if you're not a mommy. The other thing is you don't even have to be a woman. So there are men who have aged and have lost weight who want multiple procedures done on their body. So people have come up with the term daddy do-over. Again, these are kind of cute little terms that stick out and make you remember it, but it doesn't really mean that much. The surgeries that I'm doing as part of the Mommy Makeover are all done under general anesthesia. So when you see me, I'll do the surgeries in my office operating room. So I have a fully accredited, certified office operating room. I have a board certified anesthesiologist who will monitor you the whole time. I have registered nurses, physician assistants. After the surgery, you'll go to my recovery room. You'll hang out in the recovery room for a few hours until you feel okay. And once you feel okay, somebody can take you home. We will see you back in the office, usually a few days or a week later, to check on you, and then we'll follow you through the recovery process. It's very difficult for me to tell you what the recovery is going to be like for your mommy makeover. And by now you should understand why. It's because your mommy makeover is different than somebody else's. So your recovery will be very specific to the actual procedures that are part of your mommy makeover. But these are things that we'll discuss during the consultation. Once I figure out exactly what procedures are best for you, then I'll be able to tell you exactly what your recovery is going to be like, what your scar is going to be like, when you'll be able to see the final results, things like that. So if you're interested in learning more about a mommy makeover, contact my office. You can reach out to my office by phone or right here through the website and set up a consultation. I'll examine you, you tell me what bothers you, and we'll come up with a plan of what procedures we can do together in one operation and do it safely. So reach out if you want to talk more about mommy makeovers.